Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's wonderful to have you with us today in House Call. As the screen says there, acid reflux part 2. So we're discussing from a natural perspective acid reflux issues, dyspepsia, gastritis, even cancer of the stomach and intestines. So it's part 2. So what we're going to do is do a very quick review and flip a lot of slides in front of you in case you weren't with us in part 1. And then we'll get to the meat of what we want to do. So what is acid reflux? It's a condition resulting from excess secretion of hydrochloric acid. It's commonly referred to as dyspepsia. Who does it affect? It affects at least 40% of the adult population. Symptoms of dyspepsia or acid reflux: heartburn, upset stomach, diarrhea, abdominal bloating, burping, irritable bowel syndrome, nausea, belching, constipation, abdominal cramping, and intestinal gas. Now, what we're going to do are what are some of the secondary results of acid reflux: gastritis, certainly, peptic ulcers, gastric cancer, and malnutrition. Next, some symptom differentiation of dyspepsia. So we're going to do diagnostic differentiation here. So symptoms of functional dyspepsia or functional acid reflux: heartburn, epigastric tenderness, food repeating, abdominal distension, belching, and nausea. Symptom differentiation of ulcers. What are some of the common symptoms when a person has stomach ulcers: heartburn, epigastric tenderness, abdominal distension, and nausea? The next slide will show us symptom differentiation of a person who has gastritis. So they would have this epigastric tenderness, abdominal distension, and nausea. And the next slide. So what are some of the causes? Helicobacter pylori or pylori infection. We'll talk more about that. Food intolerances. People are eating foods that unbeknownst to them, or maybe beknownst to them, cause acid reflux. Spinal problems, problems within the spine that are interfering with proper nerve and blood supply to their gastrointestinal system. Use of NSAIDs or over-the-counter medications, and certainly emotional stress. Next, so what is this Helicobacter pylori? It is a bacteria that increases the risk of non-ulcerative dyspepsia. It can increase the risk of peptic or duodenal ulcers, and it can cause acute or chronic gastritis. And the next slide. Where does this H. pylori come from? It can come from hereditary, it can come from oral transmission, and most commonly comes from contaminated food or water. And next, H. pylori infects the human stomach. What does it do? It produces an enzyme called urase. This enzyme then penetrates the stomach's protective mucus, or what we call mucosa, of what we'll talk now. Stomach mucosa is a thin layer of mucus that lines everyone's stomach, and God put it there to protect the stomach from acids normally secreted by the stomach. Urase itself is an enzyme that weakens the stomach's mucosal lining. And gastric acid, what is it? Generally referred to as hydrochloric acid secreted by the stomach. Normally, the stomach, by God's design, is supposed to have an acid pH ranging between 3.5 and 5.0. And then next, pepsin. That is another digestive enzyme in the stomach. It is a proteolytic. It means it's an active enzyme. It primarily functions at the digestion of protein, and it is activated by gastric acid itself. So when we eat foods, then the stomach is stimulated to produce hydrochloric acid, and that in turn is activated to produce pepsin or gastric acid. Next slide then. Now, how would you diagnose this H. pylori? Through blood studies, through the H. pylori, what's called Ig antibodies, through a test called CO2, carbon dioxide breath test, through biopsy, such as an endoscopy, and then also through H. pylori stool analysis. And lastly, but more importantly even than the stool analysis, is the organic acid analysis. And then our next slide. Antibiotic therapy. This is many of the common antibiotics used to combat this H. pylori, but at the most, a combination of them, at the most, only 40% of them are effective. What the body does is it develops resistance against those antibiotics, and they become less and less effective on the individual. All right, now we'll go to the next slide, which will bring us up to where we left off last time. Some of the common things that can be used with antibiotics or alone is, number one is zinc carnosine. It is a natural alternative to drug therapy. It is chelated zinc sulfate and L-carnosine. It is more effective as a chelate than as separate entities. Now, what does that mean? When we chelate something, if you look at me, I'll give you a good example of that. If I have zinc out here, before it can be absorbed through my small intestine, through the distal end of my small intestine, it has to be biochemically, electrostatically, it has to be bound. Chelation in Latin means claw. It has to be bound to an amino acid, the primary one being albumin. So people can take carnosine, L-carnosine separately and zinc separately, but when you take them in a chelated form, they are much more effective. All right, so let's go back to that slide again now. So they are more effective as a chelate when they're biochemically bound than as separate entities. Okay, the next slide then. Now, zinc itself, it is an essential trace electrolyte. So all minerals are electrolytes. That means that they either have a positive or a negative charge. They either have anions in them or cations in them. All of you remember that from inorganic chemistry. What do? They bind directly to DNA double helix. So they bind to your desoxyribonucleic acid, to this double helix. It is crucial, zinc is crucial for tissue repair and healing. So it's just not stomach or gastrointestinal problems, but any tissue healing. So all of the patients that we see, unless their medication is contraindicated or their surgeon doesn't want them to take it, before they go into surgery and or after they are released from the hospital, we encourage them to be on zinc because it will help their tissues heal up quicker. Now, we don't do that until we have the permission of their medical doctor that they do not think that it's contraindicated. So don't be running off and taking zinc without talking to your medical doctor about it if you're going to have surgery or after surgeries. Now, zinc is also important for lymphocytes. Those are part of your white blood cell family. And cytokine production. Now, Dr. Jensen is going to talk more about that. Zinc is also antibacterial in nature. So now, Dr. Jensen, or Dr. Lala, is going to continue with zinc here. Okay, zinc, continued. When zinc is deficient, people have a much higher predisposition to intestinal infections. They have a much higher predisposition to impaired immune system function and distillation of or destabilization of their cell membranes. And if that occurs, when the cell membranes are destabilized, then they're not going to function as good as they should. Now, my esteemed colleague, Dr. Richard Jensen, is going to take you on a much more scientific explanation of L-carnosine. Dr. Jensen, please.
Thank you, Dr. Lala. Well, what we have is L-carnosine. It's a dipeptide composed of beta-alanine and L-histidine. So these two compounds, beta-alanine and L-histidine, are amino acids or proteins essential for health and well-being in the body. A dipeptide of this is naturally found in muscle and brain tissue. So it contributes to this tissue support. It contributes to tissue supportive effects through its ability to scavenge free radicals. So it's essentially another name that you might recognize it by is a free radical, or not a free radical, but antioxidant in that regard. As if it scavenges the free radicals, it's an antioxidant, and so it can help for the natural support of things like DNA. DNA is very susceptible to free radical damage, and so L-carnosine would help with that as well. It helps transport zinc directly into the site of ulcerification, so it helps bring it right to the points of the ulcers, and again, it helps the tissue so that it can heal. It helps protect against noxious agents as well. So we don't want to be irritating that tissue that we're trying to heal, and therefore is very important to put in nutrients that help combat that. Then we have zinc carnosine. Zinc carnosine's unique transport capabilities into ulcers are thought to be dependent upon its ability to remain in the acid pH of gastric secretions without being destroyed, which is very important. So it is able to maintain tissue supportive effects for long periods of time. So it means that the gastric pH is unable to break this compound down, so it can remain in there and have its tissue healing effects for a long period of time. That's therefore why it's nice for gastric ulcers. It promotes gastric mucosal defenses. It inhibits H. pylori, which we see is very important because H. pylori can be a cause of this. Decreases urease activity. Now remember, urease is that enzyme that's given off by H. pylori that helps thin that mucosal lining that allows the H. pylori to get through it to the gastric lining so that it can embed itself. And then in embedding itself, it irritates it, and by thinning that mucosal lining, allows the gastric acids and the proteases to get at that lining and start to erode it away as what we call a gastric ulcer. So by doing that, by removing that irritant, we decrease the gastric inflammation, which is very important in this case. So let's go on for more on zinc carnosine. Zinc carnosine, it inhibits the expression of TNF and IL-8 cytokines without affecting prostaglandin 2 production. So let's put it this way. It's important for proper cellular function. It helps the cell to do its thing. Zinc takes place in over 200 chemical reactions within the body, and therefore is a very important cofactor for allowing your cells to do what it needs to do. Like we've stated earlier, it helps with the immune function. So it's going to help a lot with the releases of chemicals that your immune system gives off, which is what we're talking about in cytokines. So then, it protects cellular integrity. It has an antioxidant activities, so it helps against damage from oxidation from the free radicals. It promotes wound healing, and it protects the gastric epithelium by allowing the mucosal to form, the mucous membrane to form there so that the urease isn't making it thin. So it protects that area. By inhibiting TNF and IL-8 cytokines, these are chemicals which are potentially harmful to cellular activity in the body, but prostaglandin 2 is important for cellular health. Zinc carnosine is therefore important for that proper cellular function. L-carnosine's transport of zinc to the wound site is also important. That's why we like that chelated form. Okay, so then let's go on to more on zinc carnosine. It stimulates mucus secretion, so not only does it protect it, but it helps stimulate it, and it's an important cofactor for the amino acids as well. Zinc is an important cofactor for many amino acids or proteins, which not only are the building blocks of the body, but primary transporters of neurotransmitters, transporters of the hormones, antibodies, electrolytes, vitamins, fats, and carbohydrates. So just about all that you digest, it's important for. Zinc carnosine is also essential for healing of the stomach and duodenal ulcers. It prevents bacterial overgrowth, and it inhibits stomach erosion and bleeding. So then, Dr. Lala, let's go into more on neurotransmitters.
Another thing we might mention about zinc carnosine is it is two chemicals, as we've said here a few moments ago, zinc and then carnosine. They are more effective in the body when we take them in as a food supplement in a chelated form. In other words, in the manufacturing process, that they took the zinc and combined it with carnosine. Now, you can buy this at health food stores, Walmart, Target, wherever you go, it's available. It's another one of those kind of, big products today that they're pushing. But there's a difference between food supplements, and the difference is this. We have two forms or two classifications of it. One is called food grade, and the other is called pharmaceutical quality. Food grade, anybody in America who has a clean enough facility can manufacture vitamins and minerals and homeopathic remedies. They can do it. It's a highly unregulated industry. Now, the difference between a food grade and a pharmaceutical quality is that the companies that produce and call their products pharmaceutical grade have submitted their products to independent laboratories for analysis. Okay, they have to do it, or they don't have to. The federal law doesn't require them to do that, but they do that themselves. And then they have an independent assay or analysis, and the report then says what's exactly in that product. So what is on the label then is in the product. Now when it comes to a food grade zinc carnosine product, it doesn't have to be. You can list anything you want on that label, and you can get away with it from now to kingdom come, because the FDA is so busy trying to regulate drugs that they have spent very, very little money. That's understandable, because there's a big dimension of lobbying in Washington to not regulate the supplement industry. Okay, you've got these opposing political forces and economic forces. And so I can produce a zinc carnosine product, or a vitamin A or vitamin D or B complex vitamin, calcium, minerals. I can produce any product that I want. And I can list on the label that it's chelated, which is a lie, and that all of these products are in there, when in fact the product may not be chelated, and all of the products may not be in there, and or maybe the products are in there, but the percentages that I list them as being in there aren't in there. In other words, they're much smaller percentages. The other thing is that for any vitamin or mineral or zinc carnosine or homeopathic remedy to work, it has to, in my body, in your body, it has to be in the proper biochemical ratio. Meaning that, say, they estimate that for every 2.5 milligrams of calcium that we ingest, there's only supposed to be 1 milligram of phosphorus. So we're going to talk about that later in the program, about these ratios. But so when you buy something that is not prescribed by a medical doctor or by a chiropractor, and I mean, they can also be distributing products. We've got companies starting up now where they say, well, we're going to produce phytonutrients, and if you come to my office, I'll make products exactly for your body. Nothing wrong with that, but generally they have no diagnostic testing of that person's body to determine if they really need that, number one, and blood analysis is the primary thing that would tell us what your body needs or doesn't need. And so if they aren't in proper biochemical ratios, it can't work. It just cannot work. So you have to be very careful when you're going to buy zinc carnosine, and a lot of these places are very sophisticated. There may be a pharmacologist there selling them there. There may be a licensed nutritionist selling them. There may be a chiropractor selling them. Now we got medical doctors selling vitamins on television and nutrients and amino acids. Does that necessarily mean that what they're saying is true? Not necessarily, because I get on television and say anything I want. I can do that. But does what we're telling you hold up to scientific analysis? And that's why we make our scripts available, because they can be judged, because we're dealing with scientific data here. So, Dr. Jensen?
One of the things that you've talked a great deal about, food quality and pharmaceutical quality. One of the things that you have to realize, in order to call it a vitamin supplement, the labeling on there you have to have a certain amount of vitamins in there. So they can put trace elements of this in there so that they can call it a food supplement. But it's the FDA regulation on it is much less than even for foods, because for foods, let's look at whole grains. When you have a product that says it's whole grain, the FDA says in order to put that on the label, you have to have, of the flour that's in there, 51% of it has to be whole grain. That's a far cry from 100% or from 75%. It's 51%. So there are minimums that they reach in order to put the labeling on there. But it's not necessarily at the quality of what you think that the labeling is actually telling you.
Interesting also that, for example, let's talk about low-carb vitamins.
Okay.
So people are on low-carb diets, and it's a wonderful diet if it's used correctly. It comes under a lot of different names, but vitamins and minerals to be held together have to have a binding agent. Like calcium just can't be floating around out there in the B-complex vitamins. So what they use then are binding agents, and they're usually carbohydrates.
Yes.
So you've got people on low carbohydrate diets taking vitamins that some expert at some nutrition store or some nutritionist or some chiropractor says, take this, it's good for low carb diets, when in fact every vitamin they're taking has got carbohydrates in it. It's just, it's asinine. It is absolutely incredible what they can get away with it. And what's the bottom line? Making a buck. That's what the bottom line is. Okay, Dr. Jensen said that I'm going to talk about neurotransmitters. What are neurotransmitters? What would they have to do with dyspepsia, with acid reflux, with irritable bowel syndrome? What would they have to do with gastritis? Interesting now. Neurotransmitters are essential chemical messengers. I once asked, not too long ago, I asked a big detail man from a great big, one of the largest drug companies in America that owns a large percentage of the food supplements that are sold in America. Years ago, when I started in practice over 40 years ago, these supplement companies were all owned by individuals. Now they've been bought up mostly by the big drug companies because they see we can make more billions of dollars doing that. And I guess that's good business, but I asked him how many chiropractors that he deals with and nutritionists that he deals with are seriously into nutrition. And this was in a certain 5-state area that he has, visits all these different doctors' offices, and he said about 10%. And I said, how many of them do neurotransmitter testing? And there was this pause. And he said, well, at max 1%. And here it's a whole area of health that is not seriously being looked at. So neurotransmitters, again, they're essential chemical messengers. They're made out of amino acid substances. What are amino acids? They're proteins. So neurotransmitters are often not in biochemical balance in people suffering with acid reflux and a whole bunch of other diseases. Neurotransmitters are essential chemical messengers which transport and trigger the increase and or decrease of biochemical activities in your body. They are like the match to gasoline. Amino acid substances that transport hormones, that's what they are. They're hormones. So neurotransmitters are amino acid substances that transport hormones and other chemicals to nerve junctions, of which in our physiology text and neurology training says they're called synapses. Now, the use of zinc carnosine, some of the uses of it. We're going to go back because it's important to the neurotransmitters. So the zinc carnosine, the chelated form, is an adjunct to antibiotic therapy. Now, alone in the treatment of acid reflux, heartburn, and gastritis. So generally, when that person is on some form of prescribed anti-acid medication and they add zinc carnosine to it, it works better. And there isn't any information that we're aware of that it's contraindicated. But again, if your medical doctor has prescribed an acid reflux medication, a prescribed medication, before you would try zinc carnosine or any other chemical, you should discuss that with him or her and make sure that they think it's okay for you. Now, Dr. Jensen is going to start at the end of our program, so we'll probably do 3 parts to this acid reflux. What are some of the natural approaches to acid reflux?
Thank you, Dr. Lalo. So what we're talking about is a natural approach to treatment of the following types of symptoms: heartburn, nausea and vomiting, to anorexia, to epigastric tenderness, to belching, abdominal distension, constipation, and diarrhea. Now, the thing that we're looking at here is not just the symptoms, but looking at the root cause of these things, to take care of the symptoms through looking at the cause of them, which in this case, we're looking at those types of things, which are like Helicobacter pylori and other causes that we had gone through in the first program. So one of those treatments for these things is first identifying food intolerances. And let's turn to Dr. Lala for more information on that.
So one of the major causes of gastritis, of acid reflux, of ulcers are food intolerances. Now, what does that mean? That's a good slide there. Ingestion of foods that the individual is hypersensitive to will upset the gastrointestinal balance and the gastric secretions, allowing for the proliferation of that H. pylori and loss of proper acid-alkaline balance. Now, we're going to look at the next slide. We're getting really close now here of scientific importance. What is pH? We have different pHs in the body. In the mouth, the pH should range between 6.0 and 7.0. In the stomach, it should range between 1.0 and 3.5. In the small intestine, in the proximal end, the beginning of the small intestine, it's still quite acid, but as it moves on towards the distal end, the further on end of the small intestine, it turns alkaline to about 7, and in that aspect of the small intestine, then it should, before it goes into the large intestine, the pH should be between 7.5 and 8.0. Now I want to talk to you a little bit about that. You can measure pHs different. Certainly, commonly is to do it through a dipstick in the urine. So we have these dextro sticks that there's different types. And so we can measure the pH. So every person that comes to us, for example, for a gastritis issue, or they're on a weight loss issue and they're patients of ours, we on every visit check the pH of their mouth by using a piece of litmus paper. We check the systemic pH of their body rather than going down into their stomach and down into their small and large intestine. We can put a little chemical on the wrist here, and that'll give us a pretty good idea of the systemic pH, the inside pH of their body. We can also then check it through the urine. So litmus paper, you can go to any drugstore and get a little roll of litmus paper and put that in your mouth, and it's going to turn a color after you keep it in there for a few seconds to 30 seconds, and then you measure it according to a pH, a color chart. We do the same thing with this agent, this chemical agent we use on the wrist. So it's easy enough to do that. Well, we've gotten through part 2 of acid reflux, and we're going to do part 3 in the next program. So if you've missed part 1, or if you think you're going to miss part 3, then you call the number that they give you, and we'll send you out the very scripts. But we're going to get more into this in the next program. So be with us then, and you'll learn a lot. You really will.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician, in care of Dr. Lala or Dr. Jensen, at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-8521. Thank you for joining us today.